Good day everyone, I am Zarah Gabriel, student nurse from University of Science and Technology. In this video, I am going to demonstrate a procedure which is administering oxygen via nasal cannula. The goal of this procedure is that the patient should exhibit an oxygen saturation within acceptable parameters. The purpose of this procedure is to deliver low concentration of oxygen when only minimal oxygen support is required to allow uninterrupted delivery of oxygen while the client ingests foods or fluids. For the implementation, bring necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated. Introduce self and identify the patient. Good day, ma'am. I'm Lhallainne Gabriel. Ako po ang inyong magiging student nurse mula alas 7 ng umaga hanggang alas 3 ng hapon ngayong araw. Ano po ang kanilang pangalan? Gabriel. Close the curtains around the bed or close the door to the room. This is to provide privacy. Explain what you are going to do and the reason for doing it to the patient. Review safety precautions necessary when oxygen is in use. Place no smoking sign in appropriate areas. So, ngayon po mag-a-administer ako ng oxygen sa inyo. Kung makikita niyo po, meron po tayo dito no smoking sign. Ibig sabihin, bawal manigarilyo dito sa loob ng kwarto o kahit saang malapit sa oxygen tank. So, okay po. Opo. Connect the nasal cannula to oxygen setup with humidification if one is in use. Adjust flow rate as ordered. Check that the oxygen is flowing out of the bronchs. And then place the prongs in the patient's nostril. Place tubing over and behind each ear with adjuster comfortably under the chin. Alternately, the tubing may be placed around the patient's head with the adjuster at the back or the base of the head. Place gauze pad at ease beneath the tubing as necessary to avoid irritation. Adjust the fit of the cannula as necessary. Tubing should not be snug but not tight against the skin. Encourage the patient to breathe through the nose with the mouth closed. Sa ilong po tayo na ako. And then, assess or reassess the patient's respiratory status, including respiratory rate, effort, and lung sounds. Note any signs of respiratory distress, such as tachypnea, nasal flaring, use of accessory muscles, or dyspnea. Remove PPE if used, then perform hand hygiene and document. Put on clean gloves to remove and clean the cannula and assess nares at least every 8 hours or according to agency recommendations.